Hi everyone. I just want to start by saying that I really enjoyed reading the preface of Dr. Cooper's book. Um I was really shocked by not shocked but kind of like surprised by like all of the obstacles that her parents went through to get where they needed to be and overcome their journey overall. Similar to Dr. Cooper, I do have family as well that has made it to where I kind of want to do more for myself. Being in this public health career field so far has been really rewarding, but definitely having a good support system behind you really helps in any venture in your life, especially I would say career wise. Um, my first impression on the case study of Anita and Deborah, the fact that they were 5 miles apart and lived completely different lives is so interesting, and it brings me to a point where it's like you never really know what people are going through behind closed doors. Just just by them being in the same neighborhood and living two totally different experiences. Um, for instance, like for Anita's case, a single black woman living in poverty, um, with a 35,000 annual income, which is not a lot considering the interest rates now. Even though the book is a little bit older, just if just anyone living off that AGI alone is it's not bearable. Um, and seeing how she also faced um health issues such as diabetes, and living in a food desert area because of there not being any grocery stores nearby in the area. We see this a lot in the Detroit area. I am from Detroit, and don't remember there ever being a time where a grocery store was very accessible in the community. Maybe like a block away or whatever. There weren't really any grocery stores nearby. You would have to go to like a Kroger or a Walmart or a Meijer, which was like could be anywhere from like 10, 15, 20 minutes away. She also faced things like her being overweight and not being able to have too much exercise because of the neighborhood she lived in, um, which plays a big part in people being able to um, do daily activities in her lives. Um, and her not being able to afford the medications that she actually needed to help with her help, her being on diabetes, her being diabetic, insulin is very expensive, and with the income that she's making, it's just not realistically affordable. For Deborah's life, it seemed like she had it way easier. Um, Living off her husband's salary, which was about 200K annually, and she was able to be a stay-at-home mom. She had a lot more access to buy the things that she wanted and do whatever she wanted. And in the event that an health issue arises for her, she was able to get the treatment um, without stressing about how to get it, how to access it, without, for instance, like not having the money for it. Um, Although she faced a similar although she had the same issue as far as being overweight or obese as Anita, she was able to go outside and be active, physically active in her community and take walks and jogs in her neighborhood without being afraid of what was to come, just because of the neighborhood that she lived in. Um, and with her having access to a lot more financially, she was also able to change her diet as well as living in a community that was not a food desert, and being able to have the access to fresh fruits and vegetables. whenever she saw fit. My takeaway for this case study is that I said it early on, but you never really know what people are going through behind closed doors. People can be in the same areas of one another and could live two completely different lives that no one would ever really know about. I think that we have to be aware of the fact that everyone isn't facing the same issues. Health disparities are a problem that we face in today's society, especially now with inflation being the number one thing for everyone right now. I can just imagine like being a single, especially being a single black mom, um, raising kids off of a $30,000 income before taxes. It really hurts because it's like it's a lot of people that are in this predicament, and when you think about it, a lot of people don't always have the access to have that same privilege that Deborah did, for instance, in the story. And a lot of people are in Anita's position or worse, even now with, especially with inflation. Um, I really like the quote in this book in the first three few pages that we read from chapter 1. It says that physical and emotional well-being are human rights and everyone deserves opportunity to live a healthy life. This really stood out to me because it seemed realistic. Everyone doesn't have the same access to healthcare. We don't have the same access to healthy foods, better communities. So there should be some type of changes that are happening for people in low income communities to live a more healthier lifestyle and be an equal to the people that are more sufficient financially. Um, and not just the people that can afford to be put in a better place. Human health should be a right. We are facing still, even though the pandemic just ended a few days ago, COVID-19, and people had to choose between going to a hospital or trying to stay at home and cure themselves because of simply not having the proper access to healthcare. I would say African Americans and other minorities, we've dealt with this for a very long time, especially during the pandemic, and losing loved ones and other I'm sorry, I'm stumbling over my words and other health issues that have been had prior to having developing COVID. Since working in the public health field, I know that health disparities are all-time high, and it will always be an issue within the public health field, especially the medical field, the healthcare field, and it has to be it has to be fixed. It has to be adjusted eventually. Over time, I feel we're in the earlier stages still. But I feel like over time we will get to a point where it's not just equality, but it's equity too, and getting able to provide those resources for those that do need it.